I'm Stacy Galandi with Ask the Doctor, a LifeScript Cedars-Sinai Women's Health Report. Heart disease is the leading killer among women in the United States. This year alone, more than 250,000 women will die from heart attacks. That's 5 times more women than will die from breast cancer. Many of those deaths could be prevented if women just knew the warning signs. LifeScript's Mari Cartel has more.
2 years ago, at 49, Kimberly Parazzoli was leading a normal life, taking care of her parents, an 8-year-old daughter, when her life changed. She was tired all the time and fighting constant back pain.
Never once did I think I was having a heart attack.
Kimberly eventually did call the paramedics.
As soon as they hooked me up, the paramedic looked at me and she said, "You're having a heart attack."
Cedars-Sinai cardiologist Noel Bairey Merz, director of the Barbra Streisand Women's Heart Center, has been studying gender differences for 25 years.
Might just be jaw pain, might just be elbow pain, might just be stomach upset or indigestion, might only be some shortness of breath or a sense of fatigue, overwhelming fatigue.
She tells us that it's not just women who don't recognize the symptoms. Some doctors also miss the signs.
Women themselves will under-recognize signs and symptoms just like physicians will, because we are all pretty much proctored and tutored to a male pattern of disease.
Which is why women need to be a lot more aware of those warning signs and speak up if they suspect something is wrong. Back to you, Stacy.
Thanks, Mari. Now we turn to LifeScript's Chief Medical Officer, Dr. Edward Geer, to find answers on what women can do to reduce and minimize their risk factors for heart disease. Welcome, Dr. Geer.
Hello.
Those statistics are frightening.
Yes, they are.
Do we know why the symptoms are so different between men and women?
It's not really known why symptoms are so different between men and women. There may be hormonal causes or genetic factors at work. We also know that women, especially under 50, tend to have hardening of the arteries that's distributed more evenly through their bodies and in tiny vessels that you can't see very well on angiograms, x-rays of the blood vessels. Older women and men are more likely to have lumpy collections of plaque in larger arteries that are more easily found on an angiogram, the classic narrowing of the artery. Women are also more likely to have untreated or undertreated heart failure, high blood pressure, and diabetes, all conditions that put them at high risk for a heart attack.
What are the differences in screening?
Well, unfortunately, the standard exercise EKG, also known as a stress test, does not work as well in women as it does in men. There are lots of cases of false positives.
Now, when women go to their doctors, what tests should they actually be asking for?
Well, because of the false positives in the stress EKG, it's best that they get a stress imaging study. Now, there's 2 different kinds of stress imaging studies that they can get. One is a stress echocardiogram, where they exercise them and then they look at their hearts using an echocardiogram. And then the other is an imaging test where they actually inject a substance in the veins, and there's a special monitor that's able to look at the heart while the person is exercising and detect whether or not it's functioning normally. Those 2 studies are much less likely to show false positive results and may identify areas where heart disease can't be found on the angiogram.
Why is the attention on women's heart health so far behind men's?
Well, you know, historically, men really did suffer most of the heart attacks, and therefore all the studies were done on men. And so we really didn't understand much about heart attacks and women. We're catching up with that now. There's something else that's been uncovered more recently. Research has found something called Microvascular-coronary-dysfunction in women in particular. It's a big medical term, but it refers to an abnormality of the smaller vessels of the heart that somehow don't respond appropriately to stress. So we're right now trying to figure out how to better diagnose and treat that condition.
I imagine that prevention is very important. So is there a special diet or a specific exercise that women should be doing in order to reduce their risk?
Well, there are really 5 things that I recommend you do to reduce your risk. First, stop smoking or don't take it up. It's really bad for your heart. Second, lose weight. Third, be active each day. The heart loves activity. Fourth, eat a heart-healthy diet. I'm sure you've heard of the Mediterranean diet. It really will lower your risk factors. And fifth, moderate alcohol consumption, meaning 1 serving of 5 ounces of wine per day for women. That will also reduce your risk factors. But check with your doctor first. Make sure it doesn't interact with your medications.
Sound advice, makes total sense, and it's very easy to do.
I agree.
Dr. Gehr, thank you so much.
You're welcome.
Appreciate it. And of course, consult your doctor before starting any new health program. For more information on women's heart health, visit LifeScript.com's Heart Health Center and Cedars-Sinai at www.cedars-sinai.edu. This has been Ask the Doctor, a Cedars-Sinai LifeScript.com Women's Health Report. I'm Stacey Galandi. Thanks for joining us.